Link TV, connecting you to the world. Link TV is viewer supported. Watch more at linktv.org.
Now let's return one more time to U.S. healthcare reform and why we just can't seem to get it right with our guest, author, journalist T.R. Reid. You know, T.R. Reid, in this speech we just heard, you suggested that the only way we're going to get from A to B would be to do it state by state. What about the state of Massachusetts? 98% of the population is now covered. Are they happy with their system?
Yeah, 67 to 70% of people in Massachusetts say it's working pretty well. They do have everybody covered, but their costs are too high. They didn't get cost control in the package. But John Kingsdale, the guy who runs it, says it's a two-step process. First, you cover everybody, and now they're going to use the leverage, the moral leverage of universal coverage to impose cost controls. That might work, and if that works, then Massachusetts is a good model for other states. I do think, you know, the states are supposed to be laboratories of policy experimentation. I think various states are going to try to get to universal coverage. A few of them will get it right, and then the rest of us can copy.
Now, you say in your speech that it's going to take a leader to step forward and show us the moral path that we need to follow. How do you rate President Obama's leadership in this area?
I don't think they did a good job on health reform. I mean, if you look at the polls, since last July or so, the number of people supporting health care reform in America has gone down every month. They didn't sell it very well. So I thought President Obama was going to be the leader to tell the American people we have an obligation to provide health care for all our neighbors. But that hasn't happened. So I've been disappointed. But, you know, this last push that they're making this spring, he has stepped up to the bat on the moral issue, so maybe they'll get it right.
Can we get it right when we have a media that, as you mentioned before, is filled with pharmaceutical, insurance, healthcare advertisements? Doesn't that somehow compromise the kind of information we're able to get in this country?
Yeah, I think it does, but then there's Link TV. You don't take any drug ads. You don't take insurance company ads. You're viewer funded, and you can provide an independent picture. And I've said all along, if Americans knew how cruel our system was, they'd fix it. We're not cruel people. If we knew that tens of thousands of our fellow citizens die every year of treatable diseases because they can't get insurance, we'd fix that. And that's the media's job, to tell people how cruel our system is, and then we'll take it on.
Link TV is the only U.S. network dedicated to global and national news, uncompromising documentaries, and diverse cultural programs. Programs which connect you to the world. To learn more, visit linktv.org.